Hi, everybody. We're joined now by Dr. Alin Gragossian. She is an ER physician from New York, and she's also a fellow heart transplant. So good morning. Welcome.
Hi, nice to be here.
So I met Dr. Gragossian a couple months ago. We connected on social media. I came across a random Twitter post of hers as a transplant patient, and I reached out to her, and we kind of connected and shared some of our common perspective as recipients, and we've kept in touch ever since. So I was really excited for you to join us today and kind of share some of your unique perspectives as a transplant patient. So maybe first thing, if you could just share your transplant story and kind of tell us how that went for you.
Sure. It was in the winter of 2018. I started feeling sick. At that time, I was an ER resident. So I guess a little bit of background before we start is I was training to become an ER doctor at that time. So I'd finished medical school in 2016. I was an ER resident when all this was happening to me, and currently I'm an ICU fellow. So I finished my training in ER residency, and I'm training to become an ICU doctor right now. So I've done lots of training. But at that time, I was training to become an ER doctor, and I was almost at the end of my training. So I had just matched into a critical care fellowship, which is really rigorous training in New York City. And it was just a couple weeks after that when I started feeling really sick. So it was winter of 2018, just towards the end of my 3 years of residency, when I started feeling like I had a cold, and I was having a cough and some shortness of breath. And over the course of a few weeks, things just weren't looking well. And a few alarm symptoms, like for example, one was that I had worsening shortness of breath. And looking back, I also had, I was very tired all the time, and I'm not somebody who really needs like much caffeine, but I remember at the time I was like drinking a lot of Red Bull. I wasn't really able to sleep that well at nights, um, and looking back, it was probably because I was trying to lay flat and I wasn't able to lay flat that well, but I wasn't putting two and two together. Anyways, all these symptoms got worse and worse. And finally, one day, I realized I just couldn't take it anymore. I wasn't breathing that well. And I went to the emergency department as a patient, not as a doctor. So I had just done a shift the day before and then the following day I went back to the emergency room and I kind of checked myself in, and it was my colleagues who were taking care of me. And we did a chest x-ray and it showed something we call bilateral pleural effusions on a chest x-ray, which basically is very non-specific. It could mean that there's a weird pneumonia. It could mean that there's congestive heart failure. But in somebody at that time, I was 30, and somebody who's 30 years old, you don't usually think heart failure. And so we were thinking maybe I had caught something from a patient, and I just had a really bad pneumonia. And my oxygenation was kind of low. My heart rate was really high, which also goes with pneumonia. Underlying, it also goes with heart failure. But again, we weren't thinking heart failure at the time. Long story short, I got admitted. And that night, when I was admitted to the hospital, when we were trying to figure out what was going on, I kind of crashed. So I became pulseless. I don't remember much of what happened. I had to get intubated. They had to put pads on me. I had to get taken to the ICU. And finally, I woke up. I was put in like a medically induced coma, and the following day I woke up and they had told me that I had like acute fulminant end stage heart failure, which basically, and I'd gone into cardiogenic shock, which means that my heart had failed to the point that none of my organs were perfusing. And there's a few things that can cause that. Sometimes that could just be acute, and sometimes like a virus could cause that, and then your heart could just regain function. But it looked like mine had been going on for a few weeks, if not a few months. And so what we thought probably had caused it was, later on we figured it out, but I had just a genetic like underlying condition and then on top of that, I had maybe caught a virus that had worsened whatever I had like underlying. And that was that. And so I was told that I needed advanced heart failure therapies, which at the time I didn't even know what that meant, even though I was a doctor. They had to transfer me to University of Pennsylvania, where they had to put me on all these medications, which I'm sure, as many of you are heart transplant or transplant patients might know, they had to put me on like milrinone and dobutamine, and had to basically be put immediately on the heart transplant list because my heart was not gaining any function. But just a few days later, luckily, just a few days later, I got a new heart, and that was it. And I went from being a completely normal and healthy person to being a heart transplant patient, which in my opinion is just a new normal.
Right.
It's nothing different. And then I was discharged just a few days later. So that's my story, basically. I went back to work about 5 months after that, and I was able to finish my residency. And then now I'm actually back in New York City. I'm an ER doctor, and I'm still training to become an ICU doctor. So really not much change other than my heart.
Right.
I like to always
Really,
emphasize that.
it's incredible that you were fortunate enough to get your transplant so quickly after going into the hospital. It's an amazing thing. My what I needed a transplant for was viral cardiomyopathy, but the part of your story where you were talking about not being able to sleep well and breathe well and these symptoms, and you said, you used the words "in hindsight," and that's what I always say too, because looking back in hindsight, the symptoms that I had were, completely obvious now, but at the time I was 26, and like you said, you don't think of anything serious being wrong when you're 26 years old. So you just
Exactly.
kind of push it off until finally you reach the breaking point. So, I'm interested, and I think everybody else will be interested in kind of your perspective on what it was like to go from a doctor training for your residency, and being the person in charge in the hospital, if you will, to being the patient and having to be the one taking orders from other doctors and listening to them. And how was that for you?
Overall, I think I was told that I was a pretty good patient. I didn't fight too much. Obviously there were times when I was frustrated with everything that was going on, but I remember at one point in the hospital stay, like I specifically remember it was one day when I kind of just like had everything out, and I was thinking about everything that was going on, and I told myself like, all right, like I'm gonna need this transplant, let's do it, and let me get out of here. Like I had no other, sure, it wasn't the best thing that could happen, but it was much better than dying. And I knew that having that attitude of like feeling sorry for myself and hating the world and hating what had happened to me, like wasn't really going to change anything. I see that often. I see people come into the ER, and I see a lot of sick people all the time, obviously, who kind of live on wanting everybody to feel sorry for themselves, and they're just kind of so sad in everything that they have. And I'm not saying it was a great thing to go through, but at the same time, feeling like it's the worst thing to go through and dwelling upon it really doesn't change your situation much. So that's kind of the attitude that I had. And so even though I was a doctor, like I didn't think that that was a big deal. I just figured I would make the most of it. And that's kind of what I did. Like, just like you, when I was in the hospital, I kind of said, let me make the most of this. Let me just get it done. And then like, if I stay alive, hopefully, which I ended up staying alive, I'll do some fundraisers. I'll make it a point to, raise awareness about organ donation. I'll do some stuff for American Heart Association, like use my voice as a physician to raise awareness about people who have transplants. So I don't know. Overall, I thought it was a great opportunity for me to do something else with the fact that I'm a physician. So, I mean, there are so many physicians out there, but I bet there aren't that many with transplants. So that's kind of how
Right.
I saw it.
Yeah, I think I've met a lot of transplant recipients through all my work with CORE and the organ donation community, and I think we all kind of have that shared mindset. At least now, that we're fortunately on the other side of it, where you look back, and I know I hear from people all the time, like, "Oh my gosh, you had a heart transplant! Like that's incredible." And all I had to do was listen to my doctors. I didn't do anything incredible, and you get put in this situation where, like you said, you just have to do what you have to do. You don't have a
Yeah.
choice at that point. So, to now a couple years later, two and a half years later for you, you said you've gone on and you're doing a fellowship in New York. So, Do you think that this has changed your perception at all as a physician? And if so, how has that influenced now how you go about your daily job?
It has. And I always tell people, the first thing I always say is I don't think every doctor needs to go through this to be a good doctor at all. I don't ever wish this upon any healthcare worker at all. However, I do think that I have like a little more actual empathy. And by empathy, I mean like I actually know what a patient is going through. I mean, this only happened to me, what was it, like a year and a half ago or whatever. So this was this incredibly life-changing thing that made me realize exactly what it's like to be in my patient's shoes. And not many people could say that. So I find it to be kind of a blessing to know what it's like. And especially in the field that I am in, like emergency medicine and critical care, um, I get to see, like, I know exactly what it's like to have central lines. I know what it's like to be intubated. I know what it's like to have arterial lines and to have like a sternotomy and chest tubes. And I know like exactly what all of the sickest patients in the hospital go through every single day. I know what it's like to get labs drawn every single week. I know how hard it is to get medications filled at times. And I think it's important for patients to know that there are physicians and nurses and people in healthcare world that actually know what that's like. I am actually working in the cardiac ICU right now, so a lot of my patients are fresh heart transplant recipients. And the other day, I had a patient who had just gotten a heart transplant, and it was actually her second heart transplant. So I kind of went in and I was talking to her, and I hadn't told her that I had a heart transplant, but then afterwards she was kind of complaining about her sternotomy, and she said something along the lines of, oh, you don't know what it feels like. And I was like, actually,
Yeah.
I totally know what it feels like. I helped her with her pain medication. So I think having that extra perspective really helps patients. Again, I don't think every doctor needs to go through it, but I think it just gives you a little bit of this extra perspective, and it helps gain that patient trust that's so important, especially in the field that I'm in. Um, and then also, what I found encouraging is that some of my own heart failure doctors, or like even any of the other doctors that I know, will be like, hey, there's this heart transplant or pre-heart transplant patient who's 30, 31, and they kind of want to talk to somebody who has a who has a heart transplant. Do you mind talking to them? And I ask them if they want to talk to you. And so like the last couple of months, I've met a couple of patients with heart failure, who are just like me and you before a heart transplant, who are kind of waiting in the hospital. And so I kind of go around and talk to them just on my free time. So I feel like that's also helpful to have this younger person talking to them about what it's like to have a heart transplant, to show them like, hey, sure, there are some things that I can't do, but for the most part, I'm living my life like I was. I never had that, I don't let that heart transplant keep me from doing most of the things that I used to do. So
Yeah, I think that's a great connection that you can have with patients. I mean, I feel like a lot of times, maybe not a lot of times, but when people are in the hospital or going through medical procedures, doctors sometimes can seem above approach, and people are kind of scared to have really intimate conversations about what they're going through with their doctors. So for you to be able to add that perspective as a transplant patient can obviously just has to put you on a whole new level of connection with your patients. So, I was very lucky. I had my transplant at Allegheny General Hospital in Pittsburgh, and the entire team, the doctors, the nurses, my surgeon, the coordinators, everybody have just been amazing ever since it happened. And they didn't go through it like you did. So I think going forward, any patient that you have is going to be very, very lucky to be treated by somebody who has gone through something and can relate to, life-changing news, life-changing events and circumstances within their life. So Dr. Gragossian has a blog that she keeps called a Change of Heart blog, which we'll tag you in the post so people can follow along. She provides a lot of great information and just daily updates on her role as a doctor and her role in life as a transplant recipient. So thank you so much for joining us. We really appreciated talking to you.
thank you for having me anytime.